Next at 4:30, our special Ask the Doctor Town Hall is a new statewide stay-at-home order has just been issued due to the COVID crisis.
We have an emergency room doctor, an infectious disease specialist, a pediatrician, and a psychiatrist all standing by live to answer your questions as the number of virus cases is hitting record levels. That's next.
This is Eyewitness News, now at 4.
4 local doctors with one agenda, helping us all navigate through the coronavirus surge. And for the next half hour, these doctors will be answering viewer questions live for an Eyewitness News Ask the Doctor special. And thanks again for joining us here on ABC7, ABC7.com, and streaming on the ABC7 Los Angeles app and Hulu Live. I'm David Ona.
I'm Ellen Leyva. Before we join our panel of doctors, here's the very latest on the pandemic as the nation faces a dangerous surge in cases. Los Angeles County reporting a staggering 5,000 plus cases of COVID-19. That's the highest number in a single day since the start of the pandemic. Governor Newsom announcing a limited stay-at-home order for non-essential work and gatherings for counties in the purple or highest tier starting this Saturday. And the CDC is pleading with Americans not to travel for Thanksgiving and not to spend the holiday with people outside their immediate household.
Well, this is vitally important. Joining us right now for this live Ask the Doctor special, Dr. Leo Lee, an infectious disease specialist at Beverly Hospital, Dr. Luis Sandoval, who works in family medicine and adult psychiatry with Kaiser Permanente Orange County. Also joining us is Dr. Anu Seshadri, primary care and pediatrics at UCLA Health, and Dr. Anthony Cardillo, CEO of Mend Urgent Care and ER medicine specialist, who joins us live every day during this newscast. And Dr. Cardillo, why don't we just start things off with you and this question that we got from Instagram, and they ask, is it true that once you get the virus, you're immune for 3 months? What are your thoughts?
Well, I certainly wouldn't say anything is true at this point with the coronavirus. We're still understanding so much as it evolves. But we do know that there are very few cases of patients worldwide that have become reinfected within that 3-month period. There are only about 2 patients that we have documented worldwide as of now that we can prove genetically with the virus that they were reinfected with a totally different new virus several months later. So it's not fair to say that it's true you can't get infected, because certainly it's possible. It's very unlikely that the first 3 months of it being infected, you'll get reinfected. But certainly, whenever we don't know something in medicine, it's always wise to err on the side of caution. So because it's so easy to follow the basic principles of wearing a mask, social distance, and washing your hands, I would highly recommend that even if you are COVID positive, you still maintain all of those measures to keep yourself and others safe.
Okay. Dr. Lee, another viewer asks, if you're in the incubation stage, are you still contagious?
Absolutely. In fact, incubation can actually vary from 2 to 14 days. The average of incubation for COVID-19 is actually about 5 days, but we do know that you are shedding virus. You can actually spread the virus, in fact, even before you develop symptoms, and typically about a day before. So during that period of time, that's why we have folks quarantined for 14 days. During that period of time, although you are incubating, you are contagious.
Yeah, so many variables on that. So our next viewer question is for Dr. Seshadri. And doctor, how safe is it for private schools to be open right now, and should they close again? What's your opinion on this one?
That's a tough question. So I'm going to say that it depends on the safety measures that the private schools are undertaking. Are they following CDC guidelines? Are they following local and state guidelines as well? So it really depends on the measures that they're taking. Are they completely online based? Are they a hybrid? Do they have a hybrid curriculum? What are they doing as far as measures if a child or staff member is positive? So it's a tough decision, but I'm going to say that we need to wait and adhere to what the local guidelines say, and also depending on what is going on within the schools right now. If they're taking stricter safety measures and the cases are very, very low to none, then they can continue to move on. But if they are seeing cases creep up, then they may need to, shut down and take other measures.
So just to clarify, it's not an emphatic yes or no. Because of those variables that you just mentioned, it is possible for schools to still be open and still be safe, in your opinion.
It varies from school to school. As being a pediatrician, it's a tough question, because I deal with this on a day-to-day basis where you're outweighing the risks versus the benefits. Being at home and online studying, yes, it is safer, but at the same time, you're losing out on a lot of coping mechanisms, that day-to-day interaction with teachers and other kids in the school. And it might not be as beneficial in developing social skills by just being at home. So that's why it's such a tough question for me to answer.
I can imagine. Well, speaking of coping skills, Dr. Sandoval, so many people are dealing with the mental health burden of this pandemic. Mitch in West Los Angeles writes, my friends and I talk about feeling overwhelmed all the time. Is that normal? He says he's just tired of everything. My daughter was just saying that to me this morning, too. What would you tell Mitch?
You know, that's a great question and something that all of us are coping with, even psychiatrists and doctors, because the real question is it okay to feel overwhelmed? We always feel like we're supposed to be in control or like we're not supposed to feel bad. But with everything going on, I let my patients know it's okay to feel overwhelmed. It's okay to not feel good because there is a new normal, there is a change, and we're still learning what that normal is. We haven't settled into it. You know, as we see, sometimes we're getting a little bit more restricted, or sometimes we're getting a little bit more open as far as the regulations that the state's allowing. And all these changes are happening fast. They're not exactly going over time. So if you are feeling overwhelmed, that's normal. But what do we do about it? I think the most important thing we can do is, one, be open about it, talk to people about it, because then we realize we're not alone in our feelings and other people are experiencing the same thing. The isolation sometimes makes us feel alone, but the reality is we're all sharing the same experiences in terms of the repercussions and the results of being socially isolated. We're feeling like we're not sure what's going on. And so what I would say is it's normal to feel overwhelmed. Make sure that you share this with your loved ones. Let people know how you feel. And if you really do feel like you can't function anymore, you get to that point that you're overwhelmed, then definitely you want to talk to your primary care, a therapist, or even a psychiatrist, and we can help walk you through this process.
Yeah, that's what makes Thanksgiving such a bummer, is because people have been isolated and they have an opportunity to actually sit down with their family. But now even that is said to be just too risky. But that's a great answer, Doctor. Now, Dr. Cardillo, another viewer question for you here. Is there anything that would prevent someone from being able to get the vaccine medically?
Sure, that's a great question as we're approaching the new vaccine coming out. So the first is going to be if you're actively infected, we're not going to be giving you the vaccine. So if you have an active COVID infection, we will not be giving you the vaccine until that settles. The second is if you've had any adverse reactions to vaccines before in the past, we'll have to evaluate you and make sure that there aren't any components in the current vaccine that you would be allergic to. For example, sometimes there are egg products and yeast products that are manufactured into the vaccine. So it's going to be current infection. It's going to be any history of reactions to any vaccines. And then, of course, there are going to be select groups of patients with certain illnesses, autoimmune diseases, currently receiving certain types of chemotherapy. There will be patients that will not be eligible to get vaccinated because of their underlying medical problems that we're currently treating. And that'll be teased out for each person with their primary care provider. So there will be some groups, and of course, we will not have a vaccine for pediatric patients under the age of 12 for quite some time. So anyone under the age of 12 won't be eligible in this first round as well.
So complex. Well, we have to take a quick break, but our 4 experts aren't going anywhere.
And we'll have more of your questions for the doctors as our special Eyewitness News Town Hall continues. Stay with us.
Welcome back. On this day, LA County saw another 5,000 new COVID cases, and the governor issued a new stay-at-home order. And we are dedicating this entire half hour of news to getting your questions answered about the virus.
Our 4 local doctors are still here with us, so let's get right back to more of your questions. And Dr. Lee, let's kick off this segment with you. A viewer asks about something we reported on yesterday. What do you think about home testing?
Wow, it's a good question. Actually, that is actually going to be very helpful in the future. Part of the problem that we've had with testing is accessibility. There's still a fair number of individuals who want to get tested, who can't get tested. A lot of the testing sites have been overwhelmed. So you can see from the news, watching photos, all these long lines of cars and Dodger Stadium, other testing sites. So having this would be helpful. The only caveat is it's only going to be available on a prescription basis. It won't be readily available to the general population. But in theory, it would be helpful. As I said, it's a test which can be done at home, reportedly fairly sensitive because it is based on genetic material. It's what we call a molecular test. It's not screening for antigen. It's actually screening for the genetic material for the virus. And it's something which can be done at home in half an hour. So that would be actually helpful in terms of helping patients decide whether they should quarantine, whether they should seek medical attention if they happen to develop certain types of symptoms. But overall, I think it is promising. But I think time will tell. We'll see how, in terms of how sensitive it is. and in terms of whether patients will be willing to purchase it.
Yeah, it'd be nice to have that. Well, another question for our pediatrician on the panel, Dr. Seshadri. Our viewer asks, if the virus is so dangerous, then why do kids age 2 and under not need to wear a mask?
It's more so dealing with the mask and potentially being able to, having the danger of possible suffocation with that mask. I think all parents have heard about SIDS, right? And this is a reason why we don't use blankets, so on and so forth, when an infant is sleeping in a crib. So yes, unfortunately, kids 2 and below, it is more of a hazard. So all the recommendations, and I wanted to say this in particular, all the recommendations that are given, we always outweigh the risk versus the benefit. And in this situation, the risk definitely outweighs the benefits of wearing the mask. This is why me in particular with this practice, as well as what I tell my patients and parents, if they are less than 2 and you need to take them out, then you can always imply other measures like putting a plastic, you use it for rain protection, but just putting like a plastic shield on top of the stroller, just making sure that there's enough space for ventilation on the sides. And that can be as equally protective for your child rather than wearing a face mask. Yeah. And last of all, I have to say, what 2-year-old is going to keep that face mask on his or her face? So,
good point.
Absolutely. They call it terrible twos for a reason. Great answer, doctor. So, Dr. Sandoval, Nikki in Los Angeles has another mental health question. She says many people could relate to. She says, I'm not looking forward to the holidays. Do you have any advice on heading off the blues?
That's a great question. And these holidays are really going to be a brand new experience for all of us if there are restrictions or we can't do our usual travel or we can't get together the way we want to. And this reminds me to being a kid and my parents telling me the holidays or Christmas are not about the presents, and so this year, really, we can kind of put that into practice. What I always say is, 1, we really want to count our blessings. Start a gratitude journal is what I tell my patients. Look at what is good in your life. And then 2, when it comes to the holidays in particular, what I say is, what's the holiday really about? We want to get together. We want to see each other. This year, what we might want to do is take that time to say, who can't I see and what would I have wanted to tell them? They're not here. You know what? The best present I can do is tell somebody how great they are or what an impact they've had on my life or how special they are to me, because that's really what we are celebrating in the holidays. We're celebrating each other, our relationship to each other, and really the impact we have in each other's lives.
Wonderful advice, and what a great gift to give somebody you love. Well, Dr. Cardillo, another question for you from Instagram, and this viewer wants to know, how do you differentiate between the flu and coronavirus?
That's a great question, and we're going to be dealing with that right about now as we enter the winter season. So the symptoms are very, very similar. We saw this last year, January, February, March, where you have fever, chills, body aches, cough, shortness of breath, nausea, vomiting, all of these things that are crossing between both diseases. Now, luckily, this season, we do have a test for the coronavirus where we didn't have that last year. So what's going to be happening is we will be testing for both. In fact, a lot of the labs and the manufacturers now have a single swab that we can use for both influenza and coronavirus at the same time with one swab. So that's going to be the mainstay for us clinically to differentiate, using our swab technology to differentiate, because it's going to be really hard clinically to tell the difference between the two. So if you're having any of those symptoms, please seek care either at the urgent care, your primary care doctor, or the ER if you're feeling really sick, and we'll test you for both.
Yeah, that's so scary going into winter and dealing with both of these things. Dr. Lee, another viewer asks, are we closer to herd immunity? What do you think?
No, I don't think so. I mean, herd immunity really requires a fair number, or in fact, a large population, a large percent of the population to be infected and recover from it. So based on what we can tell is for something which is very contagious, you need to have a large portion of the population infected or at least immunized before you can achieve herd immunity. That's where basically more people infect or become immune to the point where you can't pass off that infection to someone else. With the vaccines really coming out hopefully pretty soon, hopefully that will make a big dent. But right now, based on the best estimates, you'd have to have approximately 50 to 70% of the population infected or immunized before you can actually achieve herd immunity.
Yeah.
So I think we're quite a ways from that right now based on our numbers.
Right. All right, Dr. Lee, thank you. And we have to take another quick break, but the doctors are going to stick around for another segment.
We'll have more of your questions and their expert advice as this special Ask the Doctor Town Hall continues here on Eyewitness News.
If you're just joining us, we have 4 local doctors with us today answering viewer questions about COVID-19.
And we have time for a few more questions, so let's continue right now. This one's for Dr. Seshadri, and we reported on this question earlier this week, but we thought we'd get your thoughts. A viewer asked, can your baby get COVID if he or she is drinking breast milk from a COVID-positive mother?
Yeah, so great question again, but through breast milk in specific, the risk of transmission is quite low, right? So you're looking at through droplets, respiratory droplets that aren't found in breast milk. But it's that close proximity and potentially respiratory droplets that can be spread to the baby, and that's how you spread the transmission. But I had mentioned this a little bit before. Again, you outweigh the risks versus the benefits. The benefits of breastfeeding and having that mom to baby contact is a lot more than what the risks will be for babies as far as contracting COVID-19. As far as the research and what we've seen as far as previous studies and what we know of COVID-19 thus far, when infants or younger children do get infected, they have no to almost milder symptoms. So I would say we have to outweigh the risk versus the benefits. But the answer is no, it hasn't really been shown that it's spread through breast milk.
Yeah, thank goodness for that. Dr. Sandoval, this is a question that many parents can relate to. It's from Melissa in Pasadena. She says, my kids are so stressed out from not seeing their friends, and distance learning isn't helping. I'm frustrated. What can I do as their parent to help? What are your thoughts?
That's a great question. And one of the things that I do appreciate from this, we got to count our blessings, like I say, and let's look at what has come out of this. One thing that I realized for myself is being quarantined, I spend more time with my kids. As parents, don't forget that we can play with our kids and they actually get a lot out of that socially. We're teaching them as we're playing, how we react, how we play with each other, what the rules of the game are. And that's part of our social upbringing. As far as our friends, though, I can't substitute for one of my kids' friends. So I always let my patients know they have kids. Make sure that you are able to use social media as much as possible. If possible, have a plan for your kids to talk. But when you do have them talk or meet online or anything along those lines, have something to say, because sometimes kids will just sit there and look at each other and then they don't know what to do. But bring up different topics that they might want to talk to their friend about. Help continue to teach them those social skills of how to have a conversation or carry one. That's still very valuable, and we can still do that on the daily basis, even though it's not necessarily 100% substitute for seeing each other in person, but it is something we're still learning, we're still developing, and we're still living together and learning how to do that.
Exactly. Thank you very much for that answer. Very good point there. Dr. Cardillo, Ryan in Santa Clarita says, I got a COVID test and it was negative, but they told me it's about 70% reliable. So if you get a test like that, what do? Do you still have to isolate?
Yeah, the answer is yes. So this is a very timely question. As we saw, Elon Musk came out and he had symptoms and he had 4 tests back to back, 2 were negative, 2 were positive. So it goes to show you that these antigen tests that are out there are very low sensitivity. They're not really that reliable. So if you get a negative test, you must quarantine until you either A, get past the 14 days with no symptoms, or you get a repeat PCR test. But even that point, if you are positive, you need to be isolated. Or if you've had a known exposure to someone, even with that negative test, either antigen or PCR, you should be quarantined for 14 days. But the answer to this question is yes. If you have a negative test, you must be quarantined for 14 days if you had close exposure or you have symptoms suggestive of COVID.
Okay, great answer. Okay, so Dr. Lee, we're very short on time, but we're going to fit this one in. Grace from Granada Hills asks, why is there such a big difference in temperatures to maintain viability of the Pfizer and the Moderna vaccines? And does this mean that one has more preservatives than the other? What are your thoughts?
You know what? I wish I had the answer to that. I don't know enough about that, why the big discrepancy in terms of temperatures, because I know in addition to Pfizer and Moderna, Johnson & Johnson has one which apparently doesn't require the extremes of refrigeration. So in terms of how they developed the vaccine, I'm assuming that's probably one of the quirks of it in terms of how stable the vaccines are at certain temperatures and times of the preservatives and how they're making it. But I don't unfortunately have the answer to that because I don't really know how they've actually produced it and what are the differences in techniques in terms of producing the vaccine.
Very good. Well, we sure wish we had about 2 hours with our panel today.
Yeah,
that's
great.
all the time we have for today's special Ask the Doctor Town Hall. We want to thank all of the doctors for joining us today. We'll continue to get more important questions answered in the days and weeks ahead of this pandemic. Our regular viewers know Dr. Cardillo joins us every day here on Eyewitness News at 4 o'clock. And you can submit a question. Go to abc7.com/coronavirus. Click on Ask the Doctor.
Can't believe how fast that
I
went,
know.
too.
We
So
really do need a
quickly.
few hours.
And we do have so many other questions to ask.